So moving forward, there's several slides ahead here that talk about resources and supports. Um, so I'm not going to go into them in great detail, but I will, you can review the slide. And then I know, as I said at the beginning, you'll receive a copy of it. But here at the Cancer Center, we do have a room. It's called the Care Room. It's the primary room where there's staff that are answering our phones every day from 8 until 4. So if you need to call and leave a message for the oncologist, when you call, they immediately pull up the phone number and the chart of the patient, and they have access to see the chart. And then a message is sent through electronically through the chart to that individual's oncologist and nurse. So there are certain calls that are answered quick, I guess, quicker than others. So if it's an issue with regards to symptoms or medication, those are often answered first, and then any other questions or concerns. The nurses, what happens is in between, like in their clinics, in between patients, they'll try to call people back. And they have there's a time frame that they can call back and respond to any other issues. So the phones are answered. It says here 8:30 to 4, but technically it is 8 o'clock. I'll have that changed and updated. Um, and so generally, depending on the urgency of the call, you can anticipate that your call will be returned between 1 and 3 business days. We also have an after hours symptom management line. So if you are in treatment, if there's an individual that you're being a caregiver for and they are receiving some sort of treatment, then you can call this 1-877 number and you review the symptoms. There's a trained nurse who answers the phone. They have access to the chart and they will advise you of next steps. There's also the Connect My Health, which is online for any patient that has perhaps been admitted into hospital or has had diagnostic tests done. So it offers a free digital solution for accessing your healthcare records online from multiple hospitals across the region. There is a program through the Canadian Cancer Society. It's a transportation program called the Wheels of Hope. It is, you must have a cancer diagnosis and be receiving active treatment at the Cancer Center or coming to the hospital for some diagnostic tests. You can request a social work referral. As a social worker, what we do is there is an online application form that we fill in for you. We forward it to the Canadian Cancer Society, and then they will then contact you directly. They review the parameters of their program, and there is a $100 application fee, and that is good for 1 full year. That fee can be reduced by the Canadian Cancer Society, but they're the ones that make that decision. And if you are in receipt of Ontario Works or Ontario Disability, then those offices will pay for that fee. But there is another form that ODSP requires to have the doctor sign, and that needs to be submitted first before the transportation can be arranged. So your best bet is to request a social work referral, and then we can help you with the process. So there's other transportation services that we utilize, such as CareLink, which is within Windsor, Essex. CHAPS is in the Chatham, Tilbury area, and Handy Transit. And then we can also assist with setting up, if necessary, if there's other wheelchair or stretcher transportation that is required. So please just ask for a social work referral, and we can review your needs and assist you with all the application forms. So there's also a program called Ontario Health at Home. And this program is something that most of you may be aware of. They have changed their name several times over the years. They used to be known as CCAC or the LIN, and now they've changed their name again. So it's OHAH is the new acronym for it. And so their phone number, this is the local office that's listed here. And then there's a 1888 number, and you can visit their website as well. And all their home care supports are funded through OHIP. So generally, it's what they do. I kind of describe it to individuals as if you picture an open umbrella, and the open part of the umbrella at the top is the Ontario Home at Health Agency, and all the spokes that are attached to the umbrella are the different agencies that they have contracts with. So you may hear of individuals saying, oh, I have a nurse that comes from VON, or I have a PSW that comes from St. Elizabeth's. So there's a number of different agencies in the community, and they have contracts with them. And the individuals that actually come into your home and provide the service are hired through those individual services. And you have what they call a care coordinator that oversees all of those services and approves the number of hours that individuals will get for a PSW or a nurse. I always say one of the most important things I say to people is never say no to nursing, because if you don't have coverage for ambulance care, never say no to nursing, because if you have nursing in the home, then the $45 fee for ambulance is covered. So I say never say no. Just always say yes, in case they just want to come even once a month to take your blood pressure. They can also they provide occupational therapists that will come into your home and do an assessment of your individual home, how it's set up, the number of stairs, and they can make recommendations about different types of equipment that you know might be beneficial for you to have. Bars, not necessarily just in the bathroom, but perhaps in other areas of the home. If you've got, you know, maybe one level and then there could be perhaps 2 steps down to another level. We want to make sure that everybody stays safe at home. So they can make recommendations for different pieces of equipment. Generally, the pieces of equipment are free for the first month. And then after that, you can choose to either rent or purchase. And it gives you a month to kind of sort things out and to see, you know, sometimes people are very fortunate and, you know, they may live, say, in a senior building, for example, that has a room in the basement that has a number of different pieces of equipment that you can just use. And then when it's not needed anymore, you just return it. There are some online, there's an online Facebook group. If anybody it's on Facebook, they can access and they share equipment. And then when you're done, you just, you know, hand it back and somebody else has the opportunity to use it again. So, you know, some things, you know, it will help because it will help minimize the rental charges or the payment charges of the equipment, especially if you don't have extended benefits. They also provide physiotherapists that will come into your home and give you some exercises that would be helpful for you in your specific situation. And they have dietitians as well that do home visits. So your eligibility needs to be assessed and it's required. And then pending the eligibility, as I said, you'll be assigned a care coordinator who will oversee the assessment and the coordination of your in-home services. And as social workers here, we often assist individuals if they're, you know, not able, if maybe perhaps they've been trying to get through to their care coordinator and they can't, or they're having some issues with some of the individual services like VON or St. Elizabeth's, and their workers, you know, are saying that they're coming at a certain time, but then they show up maybe 3-4 hours later. You know, we can help advocate and contact the care coordinator and try and work out, you know, a plan that is doable for everyone. So ask your oncology care team about a referral to the Ontario Health at Home or call for an assessment. So you can call that number, this number above, and ask for the intake department and ask for an assessment. So here's another slide of resources and supports. And again, I won't go through it. I'll just kind of do a general wrap. But we have our own, we're very fortunate here in the Windsor Regional Cancer Program to have our own cancer foundation. So the hospital itself, Windsor Regional Hospital, has their own foundation, but we are very fortunate to have our own Windsor Regional Cancer Foundation. So this is their, they have they have offices here on site. This is their contact information and website, and they serve as our official fundraising arm for our cancer program. And they fulfill a number of requests that we have on an annual basis. So they have assisted in purchasing state-of-the-art equipment, and they do a number of patient support initiatives, such as the robes that are available down in radiation, and the Patient Assistance Fund. So there's a number of different initiatives that they do. So they have some fundraising programs that they do, and then there's also a lot of third-party fundraising that goes on in the community, and they donate specifically to the Cancer Center Foundation. We have our own local hospice of Windsor and Essex County. It's in the East End, located on the East End on Empress. So that's right near the intersection of Jefferson and Tecumseh. And they have their own programs there for individuals with cancer. And they have the hospice end-of-life residence. And they also have the community program where as needed, a palliative physician can come to a patient's home and provide them care, so they don't necessarily need to come back to the cancer center. And then Erie Shores, sorry, there is also a hospice in Leamington, just down the road from the Erie Shores campus, the Erie Shores Hospital there. And there's also a hospice in Chatham-Kent and one in Sarnia. So depending on what area of the LHIN you live in, we are very well resourced with palliative care, which is wonderful. So just moving on with some more resources and supports. These are some supports for more for emotional support and counseling. So as I said, we have our own social work group here. But if there's very specific issues that come up, so our social workers mainly deal with cancer-related issues for the patient and for their caregiver. But if there is some other issues that, may require some extra support, then we can assist with referrals or information for the Community Crisis Center that's located downtown on Olette at the Olette campus. Family Service Windsor Essex is just on Langlois. There's Family Services Kent and the Canadian Mental Health Association. So this is an outline of them, their addresses and contact information. And here's another slide for resources and supports. So there is a leukemia, I can't even speak today, sorry, Leukemia and Lymphoma Society. There, I think I've spoken to before about the Canadian Cancer Society having the transportation program, but they also have a community service locator online tool as well. And they're a valuable, they have a lot of very good information. So if you're wanting to know have more specific information about, say your loved one's cancer diagnosis, you can certainly call them. They have the national toll-free number, and you can call and obtain lots of information, and they can send information to you by email as well. And it's a good source if you have children in school or grandchildren or any friends that are doing some type of a project and are looking for some resources and information, they can help in that way as well. So there's some other resources that there's information on the caregiver support group at Wellspring. So Wellspring is located in Toronto, but they do offer a lot of online programs. So I encourage people to go to their website, wellspring.ca, and just browse through the resource area. They do offer specific groups for caregiver talks, mindfulness practices to support, and how to support caregivers. So they have many, many programs and services, and they're open to, providing their services not just to people that live in the GTA, but across the province. And the Canadian Cancer Society, again, has information about caregiving, and then the Ontario Caregiver Organization. So there's one specific to the province, and then the Canadian Cancer Society is a national service right across Canada. And the Ontario Caregiver Association, I just want to make this known here. There is a downloadable toolkit. It's called I Am a Caregiver. So it's again, if you're tech savvy, you can just get that and download it on your computer. There's the Ontario Caregiver Helpline, the Ontario Caregiver Organization Resource Library and Publications. There's an Ontario Caregiver Organization that supports Indigenous caregivers. And then there's another program through the Service Canada for seniors with regards to caregivers. And just making a comment about the last one there for the seniors. So if anyone is interested and would like some information, the social workers here at the Cancer Center, we do help, and we do have copies of, if anybody's interested in completing a power of attorney, which is there's two components to that: power of attorney for personal care and power of attorney for property. We do have the Service Ontario forms and information for that, and can also provide and talk about information with regards to wills. So that's another service of information that we can provide here. I always suggest to people, depending on your own personal situation, if depending on your own finances, if you have, if you own a house, for example, perhaps you might have a cottage or a boat, or, a home down in Florida, for example. The more kind of complicated someone's financial situation is, I always generally recommend that they do see a lawyer, and then just make sure that everything is set up correctly the way that they would like it to be, and all the I's are dotted and the T's are crossed. And then there's the Ontario Caregiver Organization for the 2SL LGBTQIA plus communities. And there's also, so that's in Ontario here. And then there's also one for family caregivers in British Columbia. So sometimes people are just interested in looking at the websites and looking at the various pieces of information there. And again, as mentioned before, you'll get a copy of these slides, so I certainly don't expect anybody to memorize it. You can just go back and look at the slides, and then look up any information that is relevant for you. And some more resources to support, this is more to support children. So Rethink Breast Cancer, Cancer in My Family, Start the Talk by the Canadian Association of Psychosocial Oncology, Talking to Children About Cancer by the Canadian Cancer Society, and Children and Teens. That's also based in BC. So just some good information if your family or your group of supports consists of children and teenagers, and you're trying to sort out how to speak to them and what types of information and when to give information to them. I always say to parents and grandparents and family members, I say, you know your children the best. You know how they take in information, how they deal with things emotionally. So, we can start that conversation or give you a lot of information, but ultimately, I think, you guys know your own children the best and know when and how uh, to provide them with information in a timely fashion. So again, resources to support children. Again, the Wellspring program, they have a wealth of information on their website. So I encourage people to look at that. Our Hospice of Windsor Essex, the VON Chatham Kent, and St. Joseph's Hospice in Sarnia Lambton. So these services help children up to the age of 18.